right, good afternoon, everyone, and welcome to the 9th edition of Insights. The Insights webinar is a public health webinar series hosted by EL Africa. My name is Stephanie Afar, and I will be your host for today. I work at EL Africa and currently support the National Primary Healthcare Development Agency, NPHCDA, in optimizing the electronic management of immunization data system, EMID. As such, today's discussion is particularly interesting for me. So thank you all for taking your precious time out of your day to join us for this event. Before we proceed with today's discussion, I would like to share a few words about our Insight series itself. The objective of the webinar series is to foster meaningful conversations with and between professionals and stakeholders in the public health space at large. We've successfully held 8 webinars, which has pulled in both local and international audiences. Today, I have the honor to host our discussions on the role of technology in addressing the challenges in vaccination coverage. With us today are professionals with years of experience in delivering vaccination programs and in incorporating technology into the vaccination process. For us at EHA, the topic is to build stronger health systems through the design and implementation of data-driven solutions that respond to local needs and provide underserved communities with tools to lead healthier lives. Now, on the topic of technology in vaccination coverage, it is important to highlight that one of the most important improvements in modern medicine are vaccines. They have contributed greatly in enhancing lives by reducing and eradicating many serious infectious diseases. It has been noted that vaccines prevented 33,000 deaths and about 14 million cases of diseases only in 2001. 4 million deaths worldwide are prevented through vaccination. Maternal vaccination has also saved over 750,000 lives only in 2018. In Africa, we have made tremendous gains in increasing access to immunization and reducing infant mortality. Several diseases like polio and maternal and neonatal tetanus are on the brink of eradication and elimination. However, the rates of immunization coverage has stagnated. Approximately 1 in 5 children do not receive all the necessary and basic vaccines. Several factors cause this, including the lack of reliable data for effective monitoring. The lack of reliable data has affected policy decision and has remained a challenge for African countries. Implementing technology systems in vaccination processes can hasten the flow of information, address data quality challenges, improve accountability, and provide timely information for effective decision-making. This webinar will elicit insightful discussions on successful tech use cases in vaccination programs and their potentials for driving effective data management and vaccine coverage. At this point, I would like to introduce the panelists. As our first panelist, I would like to extend a warm welcome to Dr. Desmond Mada Kambai. Forgive my pronunciation, please. He's a medical doctor and a field epidemiologist working for the Ministry of Health and Sanitation for the government of Sierra Leone. In the ministry, he has the role of program manager for the Child Health and Expanded Program on Immunization, and also the vaccine pillar lead of the National COVID-19 Emergency Response Center. Dr. Kambai has a Doctor of Medicine degree from the University of Medical Sciences in Cuba and has an MPH from the Njala University, a Master's in Physiology and Applied Epidemiology and Disease Control from the University of Ghana, and a postgraduate diploma in Leadership and Management from the University of Fayoum, Egypt. He's also an associate lecturer at Njala University College and is married with 2 kids. Welcome, Dr. Desmond. Will you please say hi to our participants?
Thank you so much. Welcome to each and everyone, and it's a pleasure to be here with you. Thank you.
Thank you. Thank you, Dr. Desmond. Next up, I have the pleasure to introduce to you Temitayo Telaga. Temitayo is a public health management expert with over 10 years experience managing complex public health and development programs. She's a program manager at eHealth Africa and leads the GHA immunization portfolio. She currently leads a team of project management and technical experts in implementing the optimization of the Nigeria Electronic Management of Immunization Data (EMIT) system for COVID-19 and other primary healthcare data. She's a graduate of physiology with a master's degree in public health. Welcome, Temitayo. Will you please say hi to our participants?
Thank you very much, Stephanie. Good afternoon, everyone, and good to be here.
Thank you. As our next guest, I'm honored to introduce Brian Atuhaire. Brian is a public health specialist with expertise in health and immunization program planning and management. Brian has over 12 years experience managing immunization and health system strengthening programs, including leading new vaccine introduction and providing technical assistance to country immunization programs in Uganda, Tanzania, Kenya, Malawi, Senegal, and Pakistan. Brian has worked at country level within Ministry of Health, emergency program immunization departments, and with organizations including Makerere University, World Vision, CATS, and WHO at country, regional, and HQ levels. Works as a program manager for high-impact countries at Gavi, the Vaccine Alliance in Geneva, providing programmatic support to Gavi grants for health system strengthening and reaching zero-dose children in Nigeria. Welcome, Brian. Please go ahead and say hi.
Thank you, Stephanie, and thanks to the fellow panelists. Glad to be here and welcome to everyone logging in. Thank you.
Thank you, Brian. At this point, we'd like to inform the audience to please make use of the Q&A sessions of this webinar. And preferably, please do not make use of the chat box for your questions and contributions. Please post your questions as the webinar progresses. The questions will be picked up and answered at the end. Also, the webinar is being streamed live on our eHealth Africa LinkedIn page. I'm thrilled to get into today's discussions. Brian, if I may begin with you. Concerning your work with Gavi, it provides an opportunity to interact with several countries and to get a global perspective. Can you share with us an overview of vaccine coverage, existing gaps, and the current efforts being made towards addressing these gaps globally? Brian, please.
Thank you, Temi, for this opportunity, and good morning, good evening, everyone logging in, depending on where you are. Yeah, I'll dive straight into it. I think we all understand that this is a very critical period for immunization globally and in our different countries. The immunization vaccination landscape has changed over the last two and a half years, obviously, because of the pandemic. And I just want to give a high-level overview of where we are globally to sort of set the stage for the discussion that delves a little bit deeper into the experiences that our participants from the countries have. We have currently over 25 million under and unimmunized children in just the year of 2021. And this is 2 million more than we had in 2020 and 6 million more than we had in 2019. So for the last 2 years, there's a very steady deterioration in the immunization coverage or vaccination coverage globally. We have seen DTP1, and this is just for your information, a measure that we are using for zero-dose children. So children that have not received their first dose of the DTP-containing vaccine. We've seen this, drop from 90 in 2019, 90% to 87 in 2020, and to around 86% in 2021. And this is according to the WHO and UNICEF estimates. Currently, we have about 18 million zero-dose children globally, and this is an increase of 5 million from 2021. So clearly that the route to deterioration, partly due to the pandemic, obviously, because we've seen numbers really go down, zero-dose numbers go up, especially from 2020 with the pandemic. And it's the same for measles, which is also a very important tracer for vaccination coverage. The highest drop in the last 2 years has been seen in Southeast Asia, which is about 9%, and Africa and a few other continents have seen a 4% drop. Now, it's also important to note that 10 countries account for about 62% of zero-dose children. And these, that include 5 Gavi-supported countries, and 4 of these are in Africa. So if I may just mention that some of these 10 that contribute, to the 62% of zero-dose children globally, we have Nigeria, Ethiopia, DRC, Angola, as part of, the countries in Africa. And it's the same for measles zero-dose, which Nigeria actually leads with the highest number of measles zero-dose children, which is about 3.1 million. Now, this is important for Africa because I think it has the greatest, the highest growth rate of the birth cohort, close to 40, a projection of about 40 million children by 2030. We are now about 38 million. So this is critical to take note as we discuss. Now, going into the efforts, just at a very high level, I wanted to highlight some specific strategies and efforts that are being put in place. One is the Immunization Agenda 2030, which I'm sure most of us are familiar with, which is aiming at ensuring no one is left behind with vaccines. And there's increased access and equitable access to vaccines for everyone. It does highlight 7 strategic priorities. I won't mention all of them, but I will highlight 2 critical ones, one on coverage and equity, and the last one on research and innovation, which is, I think, very much aligned to the discussion that we are having today. It also highlights some core principles, 4 core principles, including people-centered, country-owned, partnership-based, but and most importantly for this discussion, data guided. Now, lastly, and I'll pause after this point, and then Stephanie, you can take us forward in the discussion. From a Gavi standpoint, as you might know, we are in our what we call the 5.0 strategy of Gavi, and we have adjusted that recently to 5.1 to include the COVID vaccination and other components that are very critical to outbreak and pandemic response from the Gavi strategy side. We have also adjusted the strategy to align with the current context. And the strategy does highlight 4 sort of overarching goals. The first being to introduce and scale vaccines, including like the COVID vaccine and other vaccines of outbreak response importance. We have the health system strengthening, which also includes the resiliency part, as well as investments within data governance, data investments, and data management. And we have the sustainability of immunization programs, and lastly, the healthy markets and market shaping to ensure that we can have vaccines effectively available in a more healthy market. So I think those are, in a nutshell, some of the efforts that are being put in place by key players globally, but also a few other interventions that are going on in different countries that I guess we will probably hear from our colleagues going forward. Thank you.
Right, thank you very much for that. And it's interesting that you highlighted, some of the countries where there are challenges, and there's also been a drop in coverages. And then, also talking to Gary's approaches, ensuring that the approach is people-centered and that the solutions are homegrown. That actually brings me to Dr. Desmond. As the EPI country lead, I believe there are some challenges that we've experienced in meeting the vaccination targets within Sierra Leone. Can you please, talk us through some of the challenges that currently exist that are particularly limiting the attainment of the goals and targets of the EPI programs in Sierra Leone?
All right. Good afternoon, Stephanie, and thanks to Brian for giving a clear insight around the goals and objective of the Gavi and also the priorities. I think as he stated clearly, we are trying to reach each and every one and leave no one behind in terms of vaccination. And as he said, with the recent COVID outbreak, it has actually shown that, especially in our communities, that vaccination is not only limited to children, but vaccination is a life course approach. So in Sierra Leone, currently, we have adopted the life course approach in terms of vaccination. We want to ensure we give vaccines to each and every eligible group based on the age, as we roll out the under 5 vaccination or the first year, the second year of life. We have introduced the HPV vaccines, which we are also giving to 10 years, a cohort of 9 to 14 years. And also we are giving the COVID-19 vaccines, and we are rolling out more vaccines like the malaria vaccines and the typhoid vaccines. And there are a lot of challenges when it comes to vaccination in our communities. And it is good that we're here actually today to see how best we discuss around the role of technology in addressing the challenges in vaccination. You see, as highlighted by Brian, actually with the COVID, there has been a lot of impact on routine immunization. We are in the coverages, the 0 dose, the under-immunized children, they has increased a lot because of COVID-19. And in our country, even before COVID, the challenges have been one around the supply chain, the last mile distribution of vaccines to our health facilities. In Sierra Leone, we have 1,500 primary healthcare facilities. This might be very small when comparing to countries like Nigeria, but also distributing vaccines to all these 1,500 facilities has been a challenge in Sierra Leone during the last mile distribution. And also the cold chain capacity. In our countries, Sierra Leone, for example, and in other African countries, the main grid power supply is a big challenge. So in most of these communities or these hard to reach or riverine communities, there is no power supply. So they depend on solar, and most don't have solar. And in Sierra Leone, we have been trying to supply more the SDD, the solar devices, cold chain equipment to our health facilities. And before COVID-19, only around 50% of health facilities had the cold chain equipment. So this was a big challenge in terms of vaccination, because we cannot supply vaccines to those facilities without cold chain equipment. But luckily with COVID-19, we have leveraged on COVID-19. We have reduced that gap. At least up to 92% of health facilities within the countries now have a cold chain equipment. And also in terms of reporting, you see our data, mostly we are collecting this hard form of data. The hard copies we are sending paper-based to our health facilities. And with those paper-based, it's actually difficult to actually do a proper follow-up on defaulters or actually reach 0 dose children. So with that, mostly we are receiving the aggregated figures. So it's also difficult. So we have a lot of challenges when it comes to data, apart from the cold chain or the last mile. Data is also our big issue, because we are here to actually to have an electronic immunization system where we could actually monitor and follow up on the 0 dose and under immunized children. So most of the time we are getting aggregated figures which are actually difficult to analyze in details and actually know where these 0 dose children are or the mixed community. And also, again, our micro-planning hasn't been an integrated micro-planning. We have been doing micro-planning for different antigens. And because we haven't been doing micro-planning, integrated micro-planning, even reaching to the different target groups, taking into population, the denominator, the census data we are using, it has been very difficult in reaching out to some of these communities. So some of our challenges have been, one, no solar refrigerators in these health facilities in terms of data, last mile distribution. And also in Sierra Leone, we have a lot of riverine communities. And most of the time, crossing those river communities to deliver vaccines or to do immunization services is also a very huge challenge. I think those are some of the few challenges. As we go, we'll elaborate on more. Over to you, Stephanie. Thank you.
All right, thank you very much. I can only imagine how difficult it would be to actually achieve some of the goals that have been set across the various countries, from working in difficult terrain, riverine areas, to even experiencing challenges with identifying defaulters due to, data challenges. So Temitayo, Dr. Desmond has mentioned some of the challenges in Sierra Leone. Would you say that similar challenges are experienced? Would you say experienced in Nigeria? And how has technology been beneficial in closing these gaps?
Okay, thank you very much, Stephanie. I think that to say thank you to Brian as well for giving a very detailed overview of the vaccination challenges on a global scale. And I think quite similar to Dr. Desmond's recount of some of the challenges that are being experienced in Sierra Leone, I would say Nigeria isn't necessarily different, or it's not totally different. Just looking at the sheer number of zero-dose children and the contribution of Nigeria to that, we're talking about 3.1 million zero-dose children in Nigeria alone. It definitely shows that there are significant vaccination gaps, vaccination coverage gaps within our system. But that's not to say that a lot of work isn't being done. The government of Nigeria is currently putting in a lot of efforts to cover some of these gaps or cover these gaps. And these efforts are largely around areas of identified need and areas of identified challenges. So similar to Sierra Leone, there's issues around suboptimal logistic and cold chain management capacities in Nigeria. We also are experiencing issues with human resource capacity gaps, so availability of necessary human resources, and then also capacity gaps to be able to provide these vaccinations. We've identified the need for integration of vaccination services, routine immunization services, into other PHC service delivery or other PHC services as a challenge as well. Because if we're able to do that, then we're able to strengthen the health system as a whole and not looking at the different vaccines or the different vaccinations as standalone. I think also quite importantly, I think more resonating conversations that we're going to be having today is poor data management and availability or unavailability of digital sort of data management systems to properly help us track what the coverage is, what the contribution is across the country, and essentially inform data for decision making. And all of this, as a country, we believe, if adequately addressed, we'll be able to contribute significantly to Nigeria achieving its EPI target and closing the zero-dose gaps.
All right, thank you very much, Temitayo, for that. So Brian, I'll have to come back to you at this point. We've heard from both speakers some of the challenges, and I think one of the challenges that that both have spoken to is really the data management challenges. What is the importance of effective data management for vaccination programs? And what would you say are the key benefits and also the challenges? Right.
Thank you, Stephanie, and thank you, Dr. Desmond and Temitayo for illuminating some of these real life challenges that are facing immunization programs. I think you speak to what most people can attest to here that are involved in planning and implementation of immunization programs. Now, data is obviously always the elephant in the room as you're discussing immunization program. At Gavi, we do have an activity that most of you might be familiar with for our supported countries. It's the joint appraisal, which happens, well, used to happen every year, where partners in government and Gavi come together to assess performance of immunization programs. And during that joint appraisal review, it's always very key that data comes up as the most important issue of discussion, because it does inform pretty much everything that you're pointing to in terms of where you've come from and where you're going and the performance. I used to work in supply chain before, and we used to say without the vaccine, there's no program, there's no immunization program. Now, on the program management side, I feel like without data, there's actually no immunization program. So I feel data is one of those core elements that we need now. And why is it critical? Because it drives the program. It's the traffic light. It's the indicator of what you're doing. It's the indicator of where you need to invest. It drives the program. I think it's very difficult to do any proper planning or effective planning without good data for any immunization program, whether at a strategic level, if you're looking at the CMYP for over 4 years, or even an annual operational plan, you need to have some basic data that you can use for planning. Very critical also is that I think in the last few years, we've identified the role of data for supply chain management. And Dr. Desmond, you very well highlighted the issues around last mile delivery. How do you even know what's going on at the service level if you don't have adequate data? So every initiative that we are trying to do on the upstream of programming towards achieving both coverage and equity, I think you need good data. The other critical piece, and this is very important for us, I think, at Gavi, is accountability. I think continuously, data is an accountability tool, just like they do an audit to see how resources have been used. It's the currency for accountability for results, I think. If you have invested so many millions in an immunization program over 2 years, you want to make sure that you're seeing the same indicators around coverage, around equity, coming through from the data. And I think that's why it's really critical. You do note also that for some of the Gavi funded work, there are data filters where you cannot, for example, introduce MR if you have not attained a certain level of DPT3 coverage. So it's an accountability tool. It's a filter that informs programming, and I think it's very critical. The last two other points, and then I'll pause, is that I think data is important to drive equity agenda. Equity in terms of, like the riverine communities that Dr. Desmond was talking about earlier, to understand that you're not just having a 90% coverage at country level, but you also want to know, you want to question, where is this coverage coming from? Where do these riverine communities, how do they fit into that 90% coverage picture of the country? So that you're not, systematically leaving out certain communities. And that's why, like I mentioned in my introduction, that the immunization agenda, the Gavi 5.1 strategy, is looking at leaving no one behind. And I think that data is one of the key drivers that can lead you there. And then lastly, is really key for program performance and improvement and lessons learned. There's absolutely no way to know what's working and what's not working if the results are not coming through from a data perspective. And that's why I think it's very critical to our immunization program, both at planning, at management, for accountability, for program assessment, for performance appraisals, both self and external. I think that's really critical. I'll pause here and get it back to you, Stephanie. Thank you.
And thank you, Brian. Data is definitely the currency for accountability and very useful for ensuring equity. So, Dr. Desmond, we've now listened to Brian, spoken to us about the relevance of data for vaccination program. My question to you is, how has technology been beneficial in closing the data management gap in Sierra Leone? Are there specific use cases that you can highlight?
All right, thank you so much, Stephanie, and it's a pleasure to be here again, as I said before, and thank you, Brian. Of course, we know technology is key, and recently with I know the impact of COVID has been great on immunization and also the socio-demographic and also the standard of living globally. But also we have learned from COVID-19. We have learned a lot of lessons from COVID-19. Recently with the COVID-19, we introduced a case-based data collection or an individual data collection, wherein we collect data on each and every individual that is receiving the COVID-19, and that data is being inputted into the DHIS. When we roll it out, it became a success because we also developed or attached another software called the Rapid Pro. And through that software, we are capable of sending out reminders to people that you are due for a second dose of the COVID vaccine on this date, and you should go take your vaccine. And it worked very well. It had a lot of a direct outcome on the uptake of the COVID-19 vaccines. So with that said, also, in terms of routine vaccines, we are collecting aggregated data, and that aggregated data is being analyzed on a monthly basis to guide the actions of the district, to look at the utilization of the COVID-19 vaccine. And we also use that data to even look at the wastage rate based on supplies that are being done to the district or supply being done to health facilities. So of course, of course, the role of technology is very important. And it is based on that Sierra Leone, based on our experience on COVID-19, that we said, we want to scale the electronic register for COVID-19. We want to scale that electronic register to all antigens being given in Sierra Leone. So now we are not just talking of COVID-19 electronic register. Now we are engaging our partners to see how best, because we believe with the electronic register, it will help us better reduce on the immunized children, because children or people in general, since now we are talking of a life course approach in vaccination, each and every defaulter will be sent messages, and we will be in place to actually locate those defaulters, because we'll have their details, their phone numbers, we'll have it in our system, the DHIS, and we can easily get onto them, and we can actually determine now directly the areas within Sierra Leone where we have huge number of under-immunized children, and also areas where we are not reaching our target, where we have the zero-dose children. So for now, we are using a lot of data, but because it is aggregated data, we are yet to reach our potential. So now we are trying to roll from aggregated data to have an electronic register for immunization services. Over to you. Thank you.
Thank you very much, Dr. Desmond. I'd like to then move on to Temitaya. We've listened to Dr. Desmond giving us perspective as to how technology is being utilized in Sierra Leone to close the data gap. What technologies would you say are being utilized in Nigeria? Are there specific use cases or success stories that we can also share? Over to you, Temitaya.
Thank you very much, Stephanie. So I think for us in Nigeria, we've gone a step further. And the particular use case that I'll be talking about is the electronic management of immunization data system, also known as the EMIT system, which is a robust and homegrown data management system that was developed by the National Primary Healthcare Agency as part of the response to the COVID-19 pandemic. So as a data management system, this particular platform, like I said, started with COVID-19 or for data management, COVID-19 data management, but currently it's been expanded to also include other vaccination programs, including routine immunization, polio SIs, non-polio SIs, and the likes of that. And over the past 1 year, eHealth Africa has been working very closely with the National Primary Healthcare Agency to optimize the functionality of the EMIT system, and not just optimizing the functionality, but to also strengthen its use case for other PAT and routine immunization services across the country. An example of that, like I said, is the expansion to include routine immunization data, and then other plans to also include things around logistics and supply chain models for that end-to-end visibility for vaccine logistics, from looking at the national up until the last mile delivery. And then some of what just talking about the benefits, some of the benefits we have recorded so far is we're starting to see improvements in data quality and data integrity. So moving from the paper-based system and the risks associated with poor quality and even data loss with the paper-based system, the EMIT system is helping to strengthen the data quality and is also helping to strengthen data integrity. And we're also seeing improvements in cost efficiencies across the country. And I'll explain that a bit more. So with the optimization efforts, with the collaborations of the optimization between eHealth Africa and National Primary Healthcare Development Agency and other relevant partners in country, a performance-based feature has been included on the EMIT system, which wasn't initially there at the outset. But that performance-based system is helping us, it's providing opportunities for us to track performance of each vaccinator and each facility across country. And this provides an opportunity for us to really identify where there are performance gaps, allows us to target interventions across LGAs, states, or even vaccination sites where we're recording low performance. And it also provides an opportunity to set performance targets that are tied to payment. So with this, we're seeing that we're not just paying vaccinators or staff to provide vaccines or without any data to show for it. So we're tying that to performance or tying payments to performance, we're able to cut down on redundancies. We're able to make sure that, okay, the finances going into ensuring that these vaccines reach all and everyone, whether we be children or adults for COVID-19, is actually tied to payments, and we can see results for that. I also talked about the integration of the EMIT system with other routine immunization and vaccination programs. And I think we're already also starting to see benefits around that in terms of capacity and even human resource management, being able to use or being able to utilize same healthcare workers to provide vaccination across either COVID-19 or other routine immunization and PHC services, with trainings and capacity buildings being done on the EMIT system for that. So these are some of the, initial benefits. As we continue to integrate, as we continue to build more, we expect that we would experience some additional benefits from the EMIT system or this digital technology. But just to give in a nutshell some of the initial benefits that we have or we are currently recording using these digital solutions.
Thank you again, Temitayo. I think I would really like to draw attention to some of the things you talked about, both you talked about and Desmond also talked about. Beyond using this technology to address challenges with data management for COVID-19, we already see a common effort to move beyond COVID-19 to other antigens. Desmond mentioned that the electronic registers, they're considering using that for all antigens in Sierra Leone. And then Temitayo also mentioned the expansion of the use of the ME system into other vaccinations or immunization activities in the country. And also went on to start to highlight, some of the benefits of doing this. The reason for highlighting it is that globally we're seeing a drive and increasing conversations around integration of tools, interoperability of tools. And it's interesting to see that, in Sierra Leone and in Nigeria, we're already beginning to reap some of the benefits, not just from utilizing these tools for addressing COVID-19, but also for other immunization services. And then pulling various tools together, integrating them and seeing how they can be beneficial for other aspects of vaccination programs. Temitayo talked about supply chain and how this integration is helping to improve end-to-end visibility. Effective resource planning. I thought to emphasize integration there based on global conversation around that. Moving on. I'd like to come back to you, Brian, and let's start to talk about some of the lessons that we're learning. As Gavi is providing support to various countries and various organizations to help attain their vaccination coverage and goals as well as targets, what are some of the lessons that you would say that one can learn from all of these activities happening across the countries? Brian, please.
Well, thank you, Stephanie. And I think we already had some of the lessons that are coming in from Dr. Desmond in Sierra Leone and Temitayo in Nigeria, which are already part of a pool of resources that countries can always draw from to improve their immunization coverages. And I want to structure my response more in terms of data. I think the countries are making progress overall, and we've seen that from the recovery from the shock that happened with the pandemic, and how countries have just pulled themselves out of that, and most of them are actually on a steady route to increasing their immunization coverages. And one of the key factors here that I see the lessons from that is cutting across most of these countries is the willingness and the political will that sort of helps beyond just the immunization program team within the ministry, but looking at beyond just the immunization program, with other departments, with maternal and child health, with the communications team, to try and move together. I think that has sort of helped to unlock many barriers. Immunization is one of the services that reaches where it's the most widely reaching health service that we have globally. And I think that it being integrated with other areas, whether it's education, whether it's with nutrition, I think that has brought some advantages with it. The other aspect that I wanted to highlight, still related to that, I think the lesson that we see is, again, related to integration, but more from a PHC agenda, where the planning, the resource mobilization, the implementation is looking at a holistic level, not just specifically on immunization. I think that is important to achieve results in the short term, but then in the long term, the countries that have sustained coverage and become resilient in their immunization coverage are those that are able to sort of move from within PHC sort of system. And that's why I think the immunization agenda is very critical on trying to make sure that immunization programs going forward use that. And then I think the one thing that is very dear to my heart for me is the human resources capacity. it's a very critical thing, and I was happy to hear Temitayo flag that in terms of how EMIT also helps in human resources, remuneration, motivation, as well as accountability. And I think that's an area which is critical, because at the end of the day, you also need the health workers that are actually going to do the work to do the vaccination. So investing in human resources for health. And unfortunately, this is not an area that many partners are very free or willing. It's not the easiest for partners to really help. And that's why I think we have to applaud governments, our governments that have invested heavily around human resources for health within the immunization program. And then lastly, just to speak to the data and technology, to tie it back to what you were saying earlier, one of the lessons that I think are very cutting across is that for systems that look at the entire ecosystem, so they're not just looking at, this is a system or a platform, we will just want to launch it, and you're looking at it more vertically. I think that's a risk. So for technology systems that have been deployed in immunization systems that are looking at the entire data and technology ecosystem, whether that's people, whether that's the infrastructure that is needed, I think there's a high level or a high chance of success when you look at it from that holistic level. Thank you. Stephanie, unmute.
Thank you very much. Thank you, Brian. So still talking about the lessons and just taking us back to, how this one started this discussion, highlighting the COVID-19 pandemic and how it has actually, driven this whole idea of the use of technology to address some of the challenges in vaccination program. And also, seeing how countries, and by countries I mean from this discussion, both Nigeria and Sierra Leone are really taking some of the lessons learned from that COVID-19 experience and utilize, looking at from a PAC perspective and utilizing that to address challenges with immunization across various other vaccination or immunization programs. What are the key lessons? What key lessons would you say that we're learning in Nigeria and in Sierra Leone? So I'll start off with Temitayo to just talk us through some of the key lessons, just a few points, and then we can move over to Desmond and also draw a few points there as well. Temitayo, please.
Okay, so I think from the conversation so far, we've been able to establish that data essentially is like the lifeline to the successful, to any successful program or successful outcomes for a program. And I think that cannot be overemphasized. Looking at some of the lessons, I think I already talked about some of the cost efficiencies that we're seeing with the use of data management tools. Talked about integration and the potential for further strengthening of the health system, be it at primary healthcare level or just the general healthcare system. So I think these are some of the key lessons I would say that we are learning as eHealth Africa and even as Nigeria as a country on the importance of data and the importance of integration of data to inform decision making, be it at the national level or even up to the LGA facility levels across country. So I would say that the performance-based, like I talked about, performance-based payments and the abilities to reduce redundancies in the human resource for health in Nigeria, particularly bearing in mind that we already have a lean health workforce. That is one key lesson, and that's one thing that needs to be further explored. I think Brian mentioned the fact that this is something that a lot of governments struggle with, but Nigeria is moving, I think, in the right direction of getting this addressed. So I think that's one key lesson or one key area that needs to also further be explored and further strengthened going forward.
Right, thank you very much, Timmy. Just before Desmond responds, just a gentle reminder to the audience to please use the Q&A section of the webinar, not the chat box, to post your questions. The questions will be picked up and answered at the end. And also a reminder that we're streaming live on LinkedIn. Please feel free to share. So back to our discussions, we're talking about the lessons that we've learned. Desmond, as you speak to the lessons, I'd like you to also highlight what opportunities actually exist to further scale up technology towards attaining optimal vaccination coverage. Desmond, please.
Thank you so much, Stephanie. I will just speak to some few points as opportunities or lessons learned. One is micro-planning. With the COVID-19 rollout, what we did was a very good COVID-19 micro-planning. And Sierra Leone being among one of the 4 countries in Africa that have achieved 70% vaccination of the eligible population is because of the micro-planning that we did and the strategies that we used in rolling out the COVID-19 vaccines in Sierra Leone. And in general, and when you look at our routine immunization data, you will see that in 2021, in the first quarter of 2021, there was a drop in our routine immunization services, and in second quarter in 2021. By the time we went to 2021, the third quarter and the fourth quarter, we saw an improvement in routine immunization, because one thing we did was we started integrating our services. We leveraged on the support from COVID, the COVID Vaccine Delivery Partnership, Gavi, WHO, and all other partners, the World Bank, to strengthen our routine immunization services. So we brought about integration of services. Could you imagine that we roll out or introduce the HPV vaccines for the first time in Sierra Leone, integrating it with COVID-19? And during that integration, we achieved 117% vaccination with vaccinating girls 10 years with HPV vaccine. And also, we achieved the highest vaccination rate for COVID-19 during that 7 days of integration. And also we went further, we leveraged on that integration. And in December also, because of the cases of measles that we're having throughout the country, we decided also to integrate measles into the COVID-19, which was also a very huge success in Sierra Leone. So we leverage on COVID-19, the micro-planning. So that's why we are now saying for 2023, we want to actually leverage on that to bring out a holistic micro-planning for all our antigens. Electronic data management. Over the years, there has been a lot of improvement with lessons learned from the COVID-19. So now we are moving in the direction of digitalizing all our tools and also integrating all our reporting system. Now we introduce the ESMT, which is the electronic stock management tool, which is being used across the country to monitor stock level for all vaccines and other ancillary material. So we are also trying to integrate now into the DHIS, where we can have a common tool for reporting. And also we have already talked of the integration. We have also leveraged on the COVID-19, the support coming from COVID-19 to actually strengthen our routine immunization services and our primary healthcare services. Now we are solarizing more health facilities within the countries to ensure we have an effective vaccination system. We are supplying more solarized cold chain equipment. I said before COVID-19, only 50% of health facilities had COVID-19, had the solarized solar refrigerators. Now we are talking of up to 95% of health facilities within the country have a solar refrigerator. So we are leveraging, and also again, what the lessons we have learned from this particular is community ownership in terms of vaccination. From COVID-19, when we brought about the community engagement, the strong involvement of community leaders and vaccination champions into our immunization services, we saw a huge result. We saw a huge turnout, a huge uptake of COVID-19 vaccine that actually made us achieve the 70% that was being set. And now currently we are almost at 78% of the eligible population being fully vaccinated. So those are some of the lessons we have learned. And in terms of data management, data quality, we are doing data quality audit. We have M&A officers in all the districts that are monitoring our DHIS. They are doing data cleaning. We are having data M&A committees across the countries at district levels, where they also discuss around immunization data. And now we are not only looking at immunization, we are looking at holistic primary healthcare data because we want to leverage on COVID-19. We also want to leverage on the structures that we have in terms of immunization to actually strengthen the whole of the primary healthcare services. So in Sierra Leone, we have learned a lot from the COVID-19, and we are using those structures that we use in COVID-19 in reaching the target to scale up immunization services. Even for 2022, our routine immunization coverage was good. I think we achieved 90% in most of our antigens. It was only MR1 and MR2. We still have a dropout rate of around 16%, which is something also we want to see how best we could improve on it going forward in 2023. And as we are trying to have an electronic register for all immunization services within the country. Thank you, and over to you.
Thank you, Dr. Desmond. I heard integration a lot of times while you talked about the lessons. I think the feedback you've given, there's just a lot that countries around the world and even countries specifically in Africa can learn from. A lot of use cases that you've given us here, and a lot of information as to how you're transitioning from the use of tech for COVID-19 response to actually ensuring that the vaccination programs within your country is optimized. Thank you very much for providing those insights. We're gradually coming to the end of our discussions, and we'll be moving over shortly to take questions from our other participants at the webinar. Before we go into that, we've talked about very interesting things that we're using technology for. We've also talked about how technology is helping to close the gap. I think at this point, we can also shed some light on the bottlenecks experienced with the adoption of technology and in scaling up technology for vaccine data management. I'd like to come back again to Dr. Desmond before we also give room for Timitai to provide some insights on this from the Nigerian perspective. Dr. Desmond, with ensuring adoption and then scaling up technology for vaccine data management.
Hello, I didn't get you clear. I think there was a break at some point. Are you referring to the bottlenecks?
Yes, with the adoption of technology and in scaling up technology for vaccine data management.
Yes, thank you so much, Akin Stephanie. Well, when it comes to actually scaling up, there have been a lot of challenges, bottlenecks. One, if you look at the terrain of our country, Sierra Leone, in some of these hard to reach areas where we have our health facilities, most don't have coverage to the mobile companies. So in some of these areas, there's no internet coverage. So it becomes a huge challenge in terms of sending data. Some of these health facility staff will have to travel a mile or look for some specific areas within their communities to actually send data. And some of this is actually leading to challenges, incomplete data, so even when you look at our reporting system, we see that the reporting is complete, but the timeliness has always been an issue because in most of these areas, they don't have access to internet services. And also, as we said, also in terms of electronic data reporting, you need to ensure there is a source of power. So in some of these areas, there's no source of power. It's now we are actually trying to roll out solar electrification, solarization of most of these health facilities. So in some of these areas, they don't have power. And also when you look at the human resource, bringing electronic data collection means training of staff. And some staff actually needs a lot of training over and over. Now we are there's a transition, this is a transition process period in Africa, where we are moving from the previous generation to another generation. And also with technology, most people above 45 or 50 in some of our communities are not actually exposed to technology and even internet. So sometimes it becomes a challenge also training them over and over on the use of these electronics tools. So that's why sometimes our data, you look at the data, there are challenges around the quality of the data. And also again, you look at in terms of the mobile devices, getting the mobile tablet, the electronics tablet for these individuals to actually input the data is also an issue here. But recently we have been procuring more mobile devices to ensure we now have a national specification for mobile devices. So we are now buying those devices and distributing them to the health facilities. So the major challenges is the internet connectivity in most of those health facilities. Of course, the power source, the human resource, and the repeated training and supervision that is being needed. And also, to have this data entered, it needs a lot of financial resources, where we need to be sending data bundles to these health facilities on a monthly basis, on a weekly basis, as the case may be. So those are some of the major challenges in terms of scaling out or rolling out the electronic system.
Oh, thank you very much, Dr. Desmond. Are there other challenges that you would like to add? I would assume that some of these challenges, or I believe that some of these challenges also resonate with what we have in Nigeria. Any additional challenges you'd like to add?
The challenges are actually quite very similar. Looking at human resources, the availability, and also the capacity of available human resources. By virtue of the size of Nigeria, number of health facilities, and even like coverage that is required to adequately reach or to gain adequate vaccination coverage, we're having to leverage a lot on ad hoc staff to provide these vaccination services. And this sometimes can be quite costly, because it then means you have to train and retrain. There's also issues around attrition because a lot of these persons are not necessarily healthcare workers. So we have people being engaged that might leave the program within a year, within 6 months, within 3 months, depending on what their career paths look like, or what their career growth projections are looking like. So that has been, I would say, a significant challenge in terms of making sure that there's that adequate coverage. Also, of course, like Dr. Desmond mentioned, there's also the challenge in terms of capacity to use some of these digital tools, which also means that you have to train and retrain on the use of digital tools for people to actually be able to come on board and actually utilize them, particularly when there's been a lot of, well, I say, dependence in the past on the paper-based system. And it essentially means you have to take a sort of systematic and change management approach to be able to get people to use these digital tools at a different level. We also talked about internet connectivity. That is also a key challenge that we have in Nigeria as well. This, I think we're addressing this with the work with MKHCDA around the EMID system optimization. We're also addressing this by developing an application that has both online and offline capabilities, such that in areas where there's low or no internet connectivities, records can still be taken or data can still be collected. And then this automatically synchronizes once the recorders are in areas of better internet connectivity. And I think that has also helped significantly. It's also helping significantly to ensure that no one is left behind, and issues of data or issues of internet connectivity isn't affecting us. There's also issues around security challenges in the country. And while the government is working continuously to address these challenges, it means that there's some areas that continue to be risk-prone areas or hard-to-reach areas. And I would say, but addressing that by ensuring that staff or healthcare workers or ad hoc staff that are being engaged are engaged within the immediate localities of some of these areas, such that they're more familiar with the terrain. They're able to provide these services at little or minimal risk to themselves and also to the client. So I think those are just to highlight some challenges, and maybe not just the challenges, but also how in Nigeria we're working towards addressing those challenges or mitigating those challenges as we go.
Right, thank you very much, Temi Tayo. I would also like to, hear from Brian. We've talked about some of the challenges in Sierra Leone, in Nigeria. What would you say are the recommendations or efforts that can be made to address them? I know Demichai has highlighted some of the efforts that can be made, but from the donor perspective, what would be your recommendations for addressing some of these challenges?
Thank you, Stephanie. I think there's no one size fits all sort of approach, but there are some good practices that we could think through that have definitely worked in some places. I didn't hear, issues around coordination and interoperability as one of the challenges, but it's actually something that is critical as you address data technology solutions, because there's lots of interesting ideas and concepts that come from different sources, and I think it's important for there to be a framework where all these good ideas can come together in a coordinated manner. So I think that's one of the biggest, most important recommendations. As we engage with countries, in some countries, you find that there are different platforms, different interventions going on, each addressing, a very specific niche of problems, and yet, there's need for that harmonization. So that's very important. And then two, I think it's continuous learning and improvement. So for us to be structured in a way that we, like people say, fail quickly, learn quickly, and adapt. So for systems that are sort of self-evolving and able to self-correct, or at least are correctable, so that we can invest wisely but more efficiently. If a system doesn't work, we do recoup lessons from it and make it, use those lessons to improve the system. And I think the other things have already been highlighted. The human resources I did mention earlier. I also mentioned looking at this from an entire ecosystem rather than in very singular terms. Yeah, and I think that's pretty much what I can say from where I stand. I'll be very curious to hear what comes from our audience, but most of the things that folks on the panel highlighted are very much critical and relevant. Thank you.
Right, thank you very much, Brian. I think at this point we can, give attention to the participants on this webinar. We will now address questions from the Q&A session. I'll read through the questions and then we'll respond to them. We'll have our panelists respond to them. We have about 8 comments and questions here. The first is from Mohammed Nazir Umar, and he says, what plan does Gavi have to address issues like data quality issues related to poor network in some hard-to-reach settlements, poor data reporting, frequent stockouts of arrived vaccines, vaccine delivery to the last mile chat, still threatening coverages, and sustained efforts to reduce zero-dose children and optimize defaulter tracking? I believe this question is for Brian. Brian, please.
No, thank you very much, Nasir. I think this is a very important question. Very briefly, this obviously Gavi's investments, as I highlighted earlier, as part of the 5.1 strategy, are directed towards making sure that we leave no one behind, so towards coverage and equity. And as part of 5.1 strategy, we have very specific investments directed towards health system strengthening and resilience. And under this, we have a number of very specific strategies that actually address all the problems that you have highlighted around data, around stock and vaccine management. One, I'll probably highlight two. One is a digital health strategy, digital health and information strategy, which guides Gavi's investment specifically around data management systems, digital tools that help to identify and reach zero-dose children and sustain immunization coverage for both program performance, but as well as for accountability. Vaccines are one of Gavi's, it's the highest Gavi investment in countries. They take the highest share. And so effective vaccine management is very critical. We do have an approach called the comprehensive vaccine management that countries are familiar with, where we provide guidance, of course, with our alliance partners on very specific areas of investment to make sure that the vaccines are managed effectively, are protected, there's less wastage, there's proper accountability all the way across the supply chain from the national to the service level. And as you may know, maybe in concluding, the zero dose is one of the organizing principle for us in this strategic period. And so we do engage with countries to program specifically for identifying areas that are most in need, those that are left behind, those that have inequitably missed out chronically. And there are investments within our strategy, within the Gavi strategy, that are very much directed towards identifying and reaching zero-dose children. Part of that is the equity accelerator funding that some countries are eligible to apply for. Others, funding specifically for children in emergency settings or in humanitarian conditions. So there's a whole host of initiatives that are very specific towards vaccine management, last mile delivery, zero-dose children, equity and access, and sustaining immunization coverage. So I would be happy to share as much links and information towards that, but Nasil, you'll be happy to find that all these issues you've highlighted have already been catered for within the Gavi 5.1 strategy. Thank you.
Right, thank you, Brian, for that detailed response. So we're moving on to a question here from Mohammed Bello. He says, Dr. Desmond, my question is, are there any plans in the work you do to provide sustainable electricity for health facilities, especially those in remote areas in the country you work, in order to ensure vaccines maintain their potency and there's an enabling environment for health workers to work efficiently? Dr. Desmond, please.
All right, thank you so much for the question. Actually, that's a very good question. In fact, in Sierra Leone in general, that's the priority of the current sitting government. And we could see that a lot of improvement has been made in terms of electricity in general. There have been a great expansion on electricity in general in the whole country. So you could see that more towns, more districts in Sierra Leone are now solarized, or they have a full electricity. And also as part of the Ministry of Health, the EPI program, one thing we do is we procure the SDD, which has the solar-driven refrigerators. Those are the ones we are supplying to health facilities. And recently, with funds we are receiving, we have mapped out all the facilities in those hard-to-reach communities, those riverine communities, and even those in the border areas, as we share border with Guinea and Liberia. We have mapped out all those health facilities. And through funds received recently through the COVID vaccine delivery partnership, we have allocated some of those funds to the solarization of those health facilities. We have also recently submitted an application to Gavi for the CDS round 3 and also the HSS, where we are going to use some of those funds also to solarize some of those facilities. So solarization of health facilities and providing a grid to communities is a priority of the current government and even we at the Ministry of Health and Sanitation, because that will serve as a bonus actually to also attract healthcare providers to actually stay in some of those hard to reach areas. So we are trying to provide a package that will comprise of solarization of the health facilities, mobility, whether it's a motorbike or a vehicle, and also to provide accommodations which are also solarized or have electricity to attract healthcare workers in those communities, and also to improve on immunization services reaching zero dose and under immunized children. Because what also we have observed recently, the issue is not around the vaccines. Vaccines are available, but it's taking these vaccines to the people and also keeping these vaccines so that at the end of the day, the potency of the vaccines could be achieved. Because we are giving vaccines, and in some cases we are giving vaccines over and over doing ring vaccination, but we are still getting cases of measles. So this might not only be as a result that the vaccines are not there or people are under immunized or zero dose children, but we have to also address challenges that in terms of that with regards to the potency of the vaccine. So in terms of solar, in terms of electricity, that is the priority. And we are moving there and we are pushing to ensure all health facilities in this country are fully solarized or have a mini grid. Thank you, and over to you.
Thank you very much for that feedback, Dr. Defront. I can see that we're really running out of time, but I think we can still take one or two more questions. We have a question here from Justice Ibuli. It says, hello, eHealth Africa. With reference to the use of electronic data collection technique, how do you manage to collect data on routine immunization from facilities that are located in very rural areas where telecommunication networks are epileptic in nature? Temitayo, please. Would you like to respond?
Yes, thank you for that. And I think I already touched on that, identifying that as one of the challenges, but also talking about optimization of the EMID system to enable online and offline capabilities, such that data, we're still able to collect data, be it routine immunization or any type of data in these hard to reach locations with poor telecommunications network or internet connectivity. And with the optimizations that are going on, so like I said, or like we discussed, the EMID system has been developed for COVID-19. Integration of routine immunization is something that has happened fairly recently, I think towards the end of last year. So as we continue to optimize the system, as we continue to build on the system, these are some of the key priority areas for us, ensuring that, like I said, online, offline capabilities, there's automatic data synchronization once the recorders are in areas of better internet connectivity, and this automatically syncs to the DHIS2 platform. I think it's important to mention that the EMID system is currently interoperable with the DHIS2 national instance. So it means that we're closing that gap of addressing the challenge of internet connectivities by allowing the system to still be able to collect data even when there's no internet facility, and then automatically synchronize to the DHIS2 data warehouse once in areas of better connectivity.
All right, thank you very much. We have a question from Eunice Demisa. She highlighted the data and, as Brian rightly said, the data acts in accountability tool that helps to ensure equity. And that, as Temitayo has said, she also mentioned that Nigeria has tried to use technology via the EMID system to ensure accountability in COVID-19 vaccinations, especially for COVID-19. Yeah, COVID-19 vaccinations in particular. She also highlighted that there are some challenges that have been reported with data upload not being completed for some time. And if Temitayo can explain why that was the case and what may have happened to the data that was not uploaded at that time, and what the status is of any platform as of today. Temitayo, please.
Okay, thank you very much for that question, Eunice. And I think it's important to maybe give some context of the history of the EBIT system in terms of its development at the outset or the onset of the pandemic. Certain challenges, which I think Eunice has rightfully mentioned, that were experienced with the use of the system, server downtimes, missing data, and loss of data. And that's where eHealth Africa has come in, working closely with the National Primary Healthcare Development Agency with funding from Gavi. I already talked about working closely with them to optimize the system. And currently looking at where the system is right now, a lot of work has been done on that system in terms of optimization. So issues that were causing the server downtimes have now been fixed. There's really limited or no reports of data loss, again, based on our records with the optimized system. So I think a lot of work has gone in since 2021 when the system was developed, and currently where we are now. All those the initial teething challenges. So I want to presume that these challenges that Eunice had mentioned were part of the initial teething challenges, because those were some of the issues that we met on ground at eHealth Africa, coming in to support the government to optimize the system. But we've been able to address all of that effectively and even start to move, like I mentioned, from even just COVID-19 to other vaccination programs such as the RI, which would have been unachievable at the outset with some of the issues that the system was facing. But now with what we have, the optimized system is more stable, is more scalable. Issues of missing data, server downtimes have essentially, I would say, been eliminated on the EMIT system as of today.
Thank you very much, Team Sayo. I'm afraid that's the much that we can take for this session. I want to use this opportunity to thank you again, our participants, for the very insightful discussions, for your questions, your contributions, and for taking the time to attend this webinar. Our next Insight webinar holds on the 29th of March, 2023. You're all welcome to also participate. Before you go, please take the time to fill out the survey that shows up when you end the webinar. Thank you once again, everyone. And thank you to the panelists for sharing your experiences, your insights, your recommendations with us this afternoon. Thank you once again, and do have a wonderful week ahead.